Thanks for inviting me here for this interview, first of all. My name is Lakshmi Sundaram, and I'm working for an organization called FIND, which stands for the Foundation for Innovative New Diagnostics. A little bit about FIND itself. It's a foundation which is a public-private partnership. It brings together the best of the private for-profit industry, the expertise in developing new diagnostics, new tools, the cutting-edge medical technology, with companies and groups and academic institutions, NGOs, ministries of health that all work on diseases of poverty, so diseases in developing countries. We started off working on tuberculosis, and since then we've added a program on malaria and on sleeping sickness, and are now looking into non-communicable diseases as well. And the idea is really to be, in a sense, to bring together the best that the world has to offer in terms of expertise on diseases, expertise on program management, expertise on development of products, and bring it all together to try and address some of the problems that have been plaguing the world for decades, if not centuries. The WHO has been doing some work on health system strengthening, and there's about 6 different facets that they've highlighted within that as being important to the management of health systems. And I think diagnostics can help contribute to all 6 of those processes. So the first one was, I think, leadership and governance. The thing with diagnostics is they can help tell you what the problem is, right? Again, on an individual level, community level, and also a global level. So from a leadership perspective, they really help provide the evidence that can help decision makers actually take reasonable measures against a problem, because they help put a frame around what the disease burden is. Another issue was on health information systems. Again, diagnostics help support that situation because they can give us information on what diseases are actually there. Let me give you one example. On malaria, for instance. So in many parts of the world, we're now in a situation where the malaria prevalence is declining. And this is great news. It's often the result of some really excellent interventions involving bed nets, better, and all kinds of preventative measures. The thing, though, is that for many people, there's still this idea that if you come in with a fever, you have malaria. And so people will go see a clinician or a community health worker. They'll have a fever and will immediately be given malaria medication. And we found in certain situations where as soon as you introduced rapid diagnostic tests for malaria and taught community health workers how to use them, suddenly the malaria prevalence decreased dramatically, and in some cases decreased by like 80%. Now, this is not because rapid diagnostic tests are curing malaria. It just means that 80% of the people who were getting malaria medication actually didn't have malaria. That's a huge problem, because not only for the malaria programs themselves, because all of these malaria drugs that are going to these 80% of the people, first of all, could be used to actually treat people with malaria in other places, but also for the individuals themselves. They're going away with a drug that's actually not going to have any effect on what's actually wrong with them. And that kind of information is crucial to help you take good decisions. One of the issues around health system strengthening is also linked to health financing. And again, when you have better diagnostics, you have better information about what diseases are actually present in, if we're talking at a country level, in your country, where they're focalized as well. And that can really help you better allocate your health budgets within a country. Again, because a lot of because we often don't have appropriate diagnostic tools. I mean, there's all kinds of other problems as well, of course, in the lack of information, but this is one piece. Because we don't actually know how many people actually have a disease, because the tools that we currently use to diagnose these diseases are either so complicated or so specialized that they can't be used on a wide-scale basis, we're kind of making health financing decisions sort of based on estimates, based on numbers that are extrapolations that, and sometimes we actually don't know whether these have a link to the real situation within a country. One more issue linked to the health financing piece as well is if we're treating people for diseases without actually knowing whether or not they have the disease, we're really, in a sense, mismanaging our scarce economic resources. If we don't have access to diagnostics, there's sort of two situations that can come up. Either we don't treat at all because we don't actually know whether a person has a disease or not. That means that we have a tendency not to catch diseases early, let them get to a stage where the treatment becomes much more complicated, much more costly, which has implications obviously on budgets. Or we can end up in a opposite situation where, because we don't have a diagnostic, we just presumptively treat everyone who comes in with a certain set of symptoms. And again, that means that, one, we're wasting money, we're literally pouring money down the drain because we're giving people drugs that will have absolutely no impact on the disease that they actually have. And we're delaying the treatment of the disease that they do have because we've given them drugs for something else. So all of that put together means that we're kind of stretching already pretty scarce financial resources without any health gain at all, and probably some health losses.